Hi there, my name is Vic Veer. I'm an ENT consultant working for the NHS in central London. What I want to do today is tell you all about head and neck cancer, which is the sort of cancer we ENT surgeons sort of deal with. Now, because these cancers are relatively internal, you need to use a telescope test, what we call a flexible nasendoscopy test, where you put a telescope up your nose and look down the back of your throat. If you want to have a laugh at me, you can have a look at one of my videos which do this on myself, and you can see me sort of going up my nose and down the back of my throat, but you can look at that video later. During coronavirus or during the pandemic, when it was just at its very highest point, we couldn't really do this investigation because it was deemed an aerosol generating procedure, which means that putting this telescope up someone's nose, looking around and then pulling it out again, we were worried that the coronavirus would spread everywhere and infect everyone in the room. So this severely hampered our ability to diagnose cancers of the head and neck, and so we thought we've got to come up with a better solution to this. And what we did was make a calculator, an online type calculator that helped us work out what is the risk of the person I'm speaking to on the phone having cancer or not in the head and neck region. So this calculator is designed for use by ENT doctors and primary care professionals such as GPs, family doctors, things like that. It's not really designed for the general public. So what I don't want you to do is go away from this and go, oh, I'll just check my risk. Oh, I don't have cancer, or I do have cancer. I better get going. What I wouldn't do is use an online calculator to work out whether you should see a doctor or not. I wouldn't use this to replace seeing your family doctor or your ENT doctor. That's not the intention of this video or the calculator at all. I think all people with problems in this area and they're worried about it should go and see someone to get checked out, because the last thing we want is for someone to be missed with a cancer. So what I'm going to do is go through this questionnaire, this calculator with you on this video. And if you want to follow along, you can look at the website where this calculator is on, and I've left a link in the video description below. So straight off the bat, the first two questions are about your gender and your age. And that's important because in terms of head and neck cancer, the older you are and the more male you are, the more likely you are to have cancer. And actually, in a sort of weird sort of way, it's quite interesting to see that if you compared a 21-year-old male to a 61-year-old male and see the risk change in that person's lifetime, how much increase there is in your risk of cancer, you can see what happens in each decade of your life. Because when you complete all these questions, it'll give you a risk right at the bottom. It'll say you have a 0.5% chance or a 10% chance that you may have cancer. So the next two most obvious questions would be smoking and drinking, and that's kind of obvious. I think a lot of people know that smoking and drinking causes cancer in this area because this is where you smoke and this is where you drink. Mixing smoking with drinking, particularly spirits and smoking, causes a really high increase. They work sort of synergistically together to give you a much more elevated risk of cancer. But the way they've divided it up in this questionnaire is that they've looked at if you're a smoker, ex-smoker, or haven't smoked at all. And then there's the drinking. It basically says if you drink less than 14 units or greater than 14 units every week. Now, if you don't know what a unit is, it's a small bit of spirits in a tumbler. So typically 25 mils of 40% alcohol, for example, which is roughly this sort of size. If you have a pint of weak beer, that's about 2 units. If you have a pint of high strength beer, sort of 5.2% or something like that, that's 3 units. And you also, a large glass of wine, sort of most people drink, is about 3 units each. So you can see how it racks up pretty quickly. What I'll do is I'll leave a sort of table or something like that here, so you can see roughly how many units there are in each bit of alcohol that you drink. You have to add that up through the whole week. The first question is about hoarseness, or a change in quality of someone's voice, so it's a bit more gravelly or a bit hoarse, really. Now, I'm afraid I'm very bad at recreating what hoarseness sounds like, but I'm sure you've seen people who smoked a lot and their voice changes. What we're looking for is a change in someone's voice that lasts for 3 weeks. It's not the sort of hoarseness that sort of comes and goes, oh, I'm feeling better now, you had a drink of water, it feels a bit better, and your voice gets better. This is constant hoarseness. It doesn't change at all. It also lets you choose if there's an obvious cause for your hoarseness. For example, if you were up the night before at a football match and screaming the whole 90 minutes, or at a concert or in a very loud area where you're having to shout at your friends so they can hear you, anything that's an obvious cause for your hoarseness. But if you don't know why you have hoarseness, just sort of come on out of nowhere. If you look at how it changes the risk of someone in terms of their risk of cancer, it's important that you can see a sudden jump up in their risk. Because if you have a lesion or a mass or a lump on your vocal cords. Now, if you remember vocal cords, you've got your lungs here and two tubes come up and meet in the middle called the trachea or windpipe. As it comes up to the top here, up to this area here near Adam's apple, the larynx or the voice box sits at the top there. And in the middle of that voice box, there's a little opening closing thing here. And these are the vocal cords. So if you want to make a high note, like this, it closes together. If you want to take a deep breath in, it opens up like this. Now it's these vocal cords that can have a cancer grow on them. And if it's growing on them, there's a mass there. These vocal cords can't meet together in the midline very well. So you get a change in character of your voice. Even a small lesion will disrupt your voice relatively quickly. So it's important, if you notice hoarseness, go and see your GP and they'll do the risk calculator on you properly, but beware of that symptom. So the next question is about sore throat, and this can be a bit confusing. It sounds like, why is sore throat confusing? But it is quite confusing because they also talk about something called odynophagia. So a sore throat is persistent pain in your neck, but odynophagia is pain on swallowing. So some people have no problems at all, but when they swallow, they sort of feel it on one side. That's a different symptom altogether. But both of these questions are actually in this questionnaire. The odynophagia comes a little bit later, and I'll show you that in a minute. But a sore throat is a constant sore throat. And it's worse if it's on one side rather than sort of generalized sore throat on both sides. So if you notice, oh, it really hurts on this side and it's hurting now for about 3 weeks, that's important to let your general practitioner know. Closely related to sore throat and odynophagia, which is pain on swallowing, is something known as dysphagia. This is a difficulty in swallowing. The people basically who we're really worried about, it's not the people whose difficulty in swallowing seems to come and go. It's those people who are persistently getting problems with eating, and particularly those who are progressively getting more and more dysphagia. So what I mean is that you'll get some people who say, well, at first I thought I felt something every time I swallowed and ended up chewing my food a little bit more. After a bit, I felt like I couldn't eat things like steak because it would get stuck. And so I stuck to slightly softer foods, even things like sausages. I couldn't really eat them anymore, so I used to take the skin off so I could eat the mince on the inside. And then later, after chewing everything, that wasn't enough. I had to puree my food. So I ended up sort of slurping up my food rather than chewing it and hoping it will go down because it kept getting stuck. These sorts of people where you see a progressive worsening and a constant, persistent worsening of their dysphagia, that's really worrying. If you see anyone or if you have that problem yourself, go and see your GP straight away. Now, when we talk about neck lumps, we're talking about a constant lump that you can actually feel. It's not a feeling of a lump in your throat, because actually we come on to that later. So we're meant to have these lymph nodes which go all the way around here, down this muscle here, across round here, around the back there, and also down this muscle, the trapezius muscle down there. We all have these tiny little lumps everywhere. What we really worry about is a lump that is greater than 1.5 centimeters in its shortest dimension. So if it's this sort of elliptical sort of size, that distance there should be greater than 1.5 centimeters. On saying that, if you're worried about a lump in your neck and it's growing, go and see your family doctor about it. Don't follow sort of rules. Oh God, is it 1.5 centimeters yet? If you're worried about something, you should go and get it checked out. And if you look on this, the reason why I'm saying that, if you look on the calculator, having a lump in your neck is important because it suddenly steps up the risk of getting cancer. And the other thing to be cautious about is to say, oh, well, it doesn't feel like a cancer. It just feels a bit soft. Now that comes from, like, I remember at medical school last century learning this, where we say, look, if it feels, we talk about how it feels compared to your nose. If it feels like this on the side of your nose here, this soft bit here, it's probably just a part of you. Don't worry about it. If it feels like it's this bit here, the tip of your nose, the cartilage bit of your nose, ooh, that could be a benign tumour. It's not going to spread and cause cancer and kill you, but it's just going to get slowly bigger and bigger. And if it feels like this hard, craggy bit up here, or the bone of your nose, if it feels as hard as that, that's cancer. You should look after it and you should get it checked out. That's not strictly right for the head and neck cancer. It is right for different types of cancers, but for the head and neck, it doesn't really work that way. Some cancers can be very soft and spongy, and you think, oh, well, it feels like this, and this feels like this. It should be fine. Let's just leave it. it doesn't work that way in the head and neck. You can see lots and lots of very soft tumours in your neck, which are actually proper nasty cancers that need to get checked out straight away. Now, the next couple of questions I think fit into the lump in the neck category. One is a lump inside your mouth, or a lesion like an ulcer or something like that that isn't going away. It's important that you let your doctor know about it. And you can see the risk change as you add on that ulcer in your mouth that's been there for 3 weeks or whatever. There is also another section about lesions or lumps over the skin or in your scalp and those sorts of areas. So it could be a skin cancer in this area. That's also important. A lot of people get skin cancers on their scalp, parts here in the lower lip because the sun shines on that area there on the end of your nose. All of these areas are sort of got a lot of direct sunlight. You can get skin cancers in these areas, and it's important that you see your doctor about it and get it checked out. And before I move on, skin cancers are very different from lumps in your neck in the sense that you don't really, again, wait until they're 1.5 centimetres. You don't wait at all. If you see a funny looking mass or a lesion, even if it's just a few millimetres in size, you need to get that checked out. Now, I slightly mentioned this next question, which is about globus, or a feeling or a sensation of a lump inside your throat. And to be honest, that's a whole different video, which I am actually putting together for you. But the next thing is also important. Now I'm going to talk about pain of a different type. It's a pain going to your ear. And you think to yourself, I thought we were talking about throats. Why is the pain going to your ear? It does make sense if you understand a little bit about the anatomy and how the brain and the nerves work. You remember that your brain is just a bit of flesh inside a bony casing, and the nerves that come out of the brain need to find a way or a port out. The ear happens to be a very good way. There's an opening there for nerves to get out. So an awful lot of nerves come out from the ear and then go down into your neck. A few of them, the glossopharyngeal nerve, which goes to near your tonsil sort of area. So if you have a tonsillectomy, like a removal of tonsils, or you get tonsillitis, some people notice that the pain from their tonsil goes to their ear. And that's because the same nerve is involved. The glossopharyngeal nerve comes out of the ear and in past near your tonsil. So if you've got a pain here, you can actually feel it in your ear, and it's because the whole nerve has been irritated by this. The same thing can happen with cancers. If there's irritation of your throat and it's deep inside, actually the place that you feel it might be your ear. Because if you've got a pain in your ear, and particularly when your doctor looks in your ear and goes, looks normal to me, I don't know why you've got pain there. It looks entirely, it doesn't make any sense at all. That's one of those sort of warning signs that we think, well, if there's nothing going on in the ear, there's no infection, there's no sort of redness behind the eardrum or anything like that, is it because it's a referred pain, which means that the nerve has been irritated elsewhere and that pain has been referred onto your ear, that's why we worry about unexplained otalgia, or having earache that you can't really explain. Now, I've left this last symptoms to the end because it's called stridor. Stridor is where you have a narrowing of your airway to the point where it sounds like you really can't breathe. Sort of trying to breathe like I can't do it, but you know what I mean. You're desperately trying to breathe, but you just can't. And it makes a very noisy breathing. You can't breathe in or out, and these people get very tired. I think if you have stridor, I think it's very unlikely that you'll be going, well, hang on just a minute while I fill out this calculator on the internet. If you see someone like that, you just get in an ambulance and bring them to A&E. But it is put down there because if a tumour or a cancer is so large that it's blocking your throat like this, it's obviously a cancer, and the risk goes up very high. Some people sit at home with this sort of noise because it slowly creeps up on them. And if you hear this sort of noise, if you go on the internet, I'm sure you'll find videos of someone with stridor. It's quite scary noise that people are making. But sometimes people, because it's happening so slowly, they sort of live with it and they don't really want to see their doctor because it's quite frightening seeing a doctor, and you worry about what they might say to you. Don't let it get that far. If you've got stridor or even a hint of change in your voice, all those sorts of things, go and see your doctor. It's really important because the earlier we can find a problem like cancer, particularly on the vocal cords, we can sometimes just scrape them off and that will be the end of it. Obviously, it's not as easy as that, but it's important to catch these things early. If you catch these things early, I think you've got a much better chance of having a very normal life afterwards. Now remember, this risk is trying to explain to you your risk of having head and neck cancer, but it's just a calculator on the internet. It's not a proper diagnosis. You need to see a doctor about it. The other reason I did this video is because I think it will help people understand what the important symptoms are, the things you should be really worried about in terms of head and neck cancer. But also, you can look at your age and your gender and other symptoms and problems that you might have. You can look at the impact of smoking or drinking at the same time. You might think to yourself, actually, although I've just been checked out and I don't have cancer or anything like that, actually, if I stopped smoking, if I became an ex-smoker, or if I stopped drinking, my risk drops down quite a lot. It might be worth it for me to stop smoking, stop drinking. So I think that may help some people out there as well. So, and also some people go, well, I've got this lump and it doesn't feel like anything important. I think I'll just leave it. Now, as you know from this video, having a lump in your neck is quite serious. I think you should get them all checked out, particularly if that you're worried about it. And I guess the last reason I did this video was because if it helps one person out there get treated for cancer earlier and then get cured from cancer rather than get to the point where they've missed the chance of curing their cancer, make me feel great. I feel like I've done something. I've helped people out even without sort of meeting any of you. That would be fantastic. I also mentioned at one point I was going to do a video on a feeling of a lump in your throat, the globus sensation that some people get, actually a lot of people get. And it's quite a difficult subject, so I'll do a proper video on that and explain what this could be, what the conditions that cause it, and what the treatments are for it. I'll put that video up here if it ever does materialize, because it's a long video and it's quite difficult, but I will go through that at one point. But in terms of the calculator, I hope it helped you, this risk calculator for cancer, and take care. Thanks a lot. Bye-bye.